We spend a large proportion of our waking life working. Work influences our health, for the positive, through a sense of identity, purpose and income. And for the negative, affecting our mental and physical health. COVID-19 has shone a light on workplace mental health, particularly for those working on the front lines, health, emergencies and humanitarian workers.
But what the pandemic has made visible is what health and social sector workers have been doing for years. They do this with smiling faces, but behind this face, a lot are battling with mental health issues arising from the work.
We always work under unstable and challenging situations, and we also witness the human suffering in natural and man-made disasters. This may cause immediate stress to us, but in some cases, it may also create some long-term mental health impact.
At times, I did find it difficult to stay positive, to stay motivated, and of course this affects your work.
We had been affected severely in terms of mental health. We had to cope up with anxiety, stress, and fear.
Medicine is tough. It demands a lot out of you, emotionally, intellectually, physically.
The stress levels in relation to disrupted work environment and also disrupted personal life and having to work from home has also negatively impacted on mental health in our workplace.
I've had quite a few patients where I've had to tell their relatives they've died via FaceTime. I certainly have had my moments where I've been completely distraught. I've definitely been crying at work.
Mental health isn't just an issue because of the pandemic. Mental health at the workplace needs our attention now more than ever.
I think the key thing is flexibility and also I would say trust between work colleagues, trust that they are doing their best in the circumstances.
The objective is to reinforcing their professionals' own resources and their coping mechanisms.
It is paramount important for the health workers to have optimal physical and psychological health to provide the best care to the patients and the community.
We need to act to end stigma so our colleagues who are struggling with mental health problems will believe that they can ask for help and receive it without being judged by their colleagues or supervisors.
There should be increased openness about issues related to stress, depression, anxiety, or other mental illness.
A bit more education about mental health to make sure that all the staff know that they can go to someone, there's someone they can talk to, or there's nothing wrong with asking for help.
I definitely would like to see healthcare professionals get access to managers that are trained in mental health that can provide real meaning support for us when we need it the most.
Conversation really can be part of the cure. It's okay to say, I'm not okay, and we need to provide people with time, with safety, so that they know that they're not alone.
If I injure myself, I'm offered physio. I'm offered anything possible to get me back to work as fast as possible. Why is there not the same investment in mental health?
Addressing workplace mental well-being can help strengthen the positive, protective factors of employment.
We can preserve our nursing workforce. We can improve society's health and decrease disability if we partner with employers to address these issues.
The whole issue of mental health is important for nurses, healthcare workers, and for all of society.
We have to spend more time to invest in mental health because to lead balanced personal and professional life in peaceful way.
Mental health doesn't just exist at home. It exists everywhere you go. That has to be looked after, not just by us, but also by the people who employ us.
The time to invest in workplace mental health is now.